Hi guys, so you've inquired about the fat loss IV drip with us, and I'm Rishi Tandulwadkar, the founder of Alive, and I'm here to guide you through what the drip really is, how it's going to work for you, what lifestyle changes you need to make with it, what are certain do's and don'ts that have to be followed with the drip, and just give you an overall idea who this is ideal for and who this may not really give results for. So, firstly, this drip is not similar to the Ozempic, semaglutide, Mounjaro, all these hormonally modifying medications that are available today to help your body lose weight. There's about 11 elements in this drip. There's the B12 B complex, which helps all these other elements work. What are these other elements? Some of them we call lipotropic elements. These help the body burn the fat, prevent the deposition of the fat, and also exit the fat out. Along with this, there are some amino acids that also accelerate fat metabolism in a much better way than you would on your own. While this drip is doing all these things for you, you need to make certain lifestyle changes that simulate the effect of the drip as well. Because everything in here is natural and water soluble, right? So, whatever is excess is flushed out immediately, whatever is taken into the body stays for just 2 or 3 days. So after the 2 or 3 days, the 4 days that you're on your own, this is a once a week drip to begin with. In the 4 days, you have to do things that will accelerate your fat metabolism, prevent the deposition of the fat, and also exit the fat out. So the first thing, accelerating metabolism. That includes on your end just doing some brisk walking. To begin with, we only need you to start with brisk walking, no other form of exercise. We look at doing at least 45 minutes to an hour a day and build on 5 minutes every week after that until you reach about an hour 15 to hour and a half. The second thing is calorie deficit. Without calorie deficit, it is impossible for anyone to dedicatedly start burning fat. So calorie deficit is a crux of any form of weight loss protocol that you have to do, including ours. We give you a guideline on how to eat, what not to eat, but it's not getting into details of telling you about the food items you eat this, eat that. It's more on the lines of, okay, avoid this, avoid that, avoid that. So you need to avoid rice. You need to avoid any form of simple carbs, which are your breads and wheats. And you need to avoid sugar of any form. Honey, jaggery, sugar-free, all of them cause an insulin spike in the body. So we're fully trying to avoid sugar-frees and sugars of any form. Eliminate these things, focus on getting good enough amount of protein and fiber and a little bit of complex carbs and fats. It needs to be a balanced diet. We don't want to starve ourselves. We don't want to also not have, have a mental impact of this, of not eating this and not eating that. Stress and mental health has a major implication on fat loss. And those are things that need to be looked at as well. So this drip is ideal for individuals that are already on their way on a weight loss journey, have started losing some weight, reached a plateau, or have tried a lot of things, are doing the diet, the calorie deficit, the walking, but still not being able to lose weight. These individuals just need to be retrained. Their bodies need to be retrained how to burn the fat. Whenever we are in a calorie surplus, what happens in our body is that you eat a carb or a sugar or a fat, your body doesn't need it for energy. So it checks, do I need it for energy? No. I don't need it for energy. Okay, let me convert it to fat to be used for later. But when we're in a constant calorie surplus, it constantly keeps going to the to be used for later component and keeps depositing fat in the body. Over time, your body forgets to check that this to be used for later is there because you're constantly in a calorie surplus. So calorie deficit is a key. When the body starts doing a calorie deficit, the drip comes in and drastically helps you start burning the fat. Not too much is needed from your end. So the calorie deficit and the walking. While all of this is happening, water intake is very, very important. We push our individuals and our patients to have at least 2.5 to 3 liters of water a day, including some electrolytes, sugar-free ones, natural ones, nimbu pani or coconut water, things like that. Lemon juice, coconut water are basic electrolytes that are good enough to get you started. While you're doing all of these things, we can expect great results, but I cannot promise you on day one how much you're going to lose. Some people lose inches first, some people lose weight first, but in a longer scale of things, dedicatedly our focus is to first burn inches. You lose 5 inches, you lose only 2 kilos, that's okay. But if you lose 5 kilos and just half an inch, that's an issue because now you've lost muscle mass, not necessarily have you lost fat. Our best case results have been individuals who have been able to follow all this to the T, We've had a person who's lost about 7 kilos in a month. We've had a lady who's lost about 15 kilos in 3 months. But more importantly, the 7 kilo person lost 4 inches in that month. The lady who lost 15 kilos also lost about 9 to 10 inches in those 3 months. Similarly, we have had some great results with individuals who've been able to adopt some lifestyle changes into their life. But we also have people who take about 3 months to lose 4-5 kilos, which is okay. Not everyone can do everything at one given point of time. Some people lose a little bit, then gain a little bit, then lose a lot more. It's a process. Generally, for everybody, we advise you start with the first 5 sessions, which is your introduction course. 5 sessions once a week over a span of 5 weeks is enough for us to get started on training your body to burn the fat. Most individuals who apply the lifestyle changes start seeing results in the third and fourth session. You will end up losing an inch and a couple of kilos in your first 5 sessions. After that, you can decide, okay, am I being able to do the lifestyle changes? Because if you don't do the lifestyle changes, the drip is not going to give you the results we need. Collectively, if you think, okay, I can do, generally people end up taking about 12 to 20 sessions. This is a period of somewhere in the range of 3 to 5 months. It's a process. We're with you. Of course, we'll give you certain other tips and tricks as time goes by when the initial weight loss results and inch loss results starts coming in. So end to end, this is how the drip works. This is who it's ideal for. And these are the certain lifestyle changes that you need to do for it to work best for you. Who do we not advise this drip for? For individuals who cannot control what they can eat. This drip to an extent will help you curb your cravings. But if you don't have a strict control or you don't think you can get a strict control and get a calorie deficit, then this drip is not going to work for you. Another thing is diabetics who are on insulin. If you're in the pre-diabetic and a diabetic range where you are, just taking medication, you can still take the drip. But the diabetics who are on insulin have insulin resistance very deeply set into their system. So the fat loss drip on its own does not help. Here we need to plug in an aspect of our regenerative therapies where we use your own stem cells to regenerate your pancreas, which will start producing more insulin, bring down your insulin level, and then you can focus on weight loss. Purely the fat loss drip will not help if you're a diabetic who's taking insulin. Some common things that you need to dedicatedly avoid when you're on the drip. Ideally, we want you to be off alcohol as well. We want you to reduce your smoking, and we would like you to try and reduce stress levels in your environment. All these things have a factor in your weight loss journey. The alcohol intake does not have a direct impact. None of these things are things that, if you can't do that, you can't do the drip. You can still do the drip. It's just that the results might be a little bit more delayed. And you need to very religiously focus on the walking, the water intake, and the calorie deficit. End to end, this is how everything works. If you think you're ready for the journey to help you accelerate the fat burn, reach out and the drip will work for you. If you're anywhere on the fat loss journey and in two minds, whether this is right or not right, come in and we can still have a detailed chat and see how we can work things out.